Hi, I'm Michelle Risser, and I'm a licensed therapist, and let's talk about medication for OCD. Obsessive-compulsive disorder, or OCD, is an anxiety disorder that involves obsessive thoughts and compulsive behaviors. Treatment for OCD can include medication and therapy. There are several different types of medications that are effective for treating OCD, but SSRIs are typically preferred because they're safe and effective. Medication is often recommended as a treatment for OCD. Some people with mild OCD may be able to recover with therapy alone, but if symptoms are moderate to severe, then treatment usually includes both therapy and medication. If symptoms of OCD are interfering with your life, causing you distress, and not improving with therapy, you might want to consider whether medication might be right for you. If you're thinking about medication for OCD, you can start by speaking with your physician or seeking a consultation with a psychiatric provider like a psychiatrist or a psychiatric nurse practitioner. Common SSRIs used to treat OCD include fluoxetine or Prozac. Fluoxetine or Prozac is a commonly prescribed antidepressant that affects serotonin levels in the brain and has a low risk for harmful side effects. Paroxetine or Paxil or Paxiva. Paroxetine is another type of SSRI that's used to treat OCD. Doses of up to 100 milligrams of paroxetine may be needed to manage OCD symptoms. Fluvoxamine was the first SSRI shown to be effective for the treatment of OCD. It's FDA approved for adults and children over 8 years old. Doses of up to 300 milligrams may be prescribed to help alleviate OCD symptoms. Zoloft. Zoloft, which is also available as the generic sertraline, is another SSRI that's approved for treating OCD in people ages 6 and older. Like other SSRIs, Zoloft is generally considered safe, but it can cause certain side effects. Celexa. Celexa, known by the generic citalopram, is also an SSRI. While it's not FDA approved specifically for OCD, studies do show that it's effective for alleviating symptoms of OCD, and some providers will prescribe it off-label for this purpose. Tricyclic antidepressants like clomipramine work on the serotonin receptors in the brain. This medication has been used since the 1980s as a treatment for OCD and is considered effective for adults and children over 10 years old. However, clomipramine can cause certain side effects, including dry mouth, drowsiness, GI issues, increased heart rate, and weight gain. These side effects are more likely at higher doses, including doses of 250 milligram or more. Because of the potential for developing these side effects, providers are cautious about prescribing this medication. If you are prescribed clomipramine, your provider will discuss the possibility of side effects with you and closely monitor you. Tricyclic antidepressants also have a black box warning. This is the most serious type of warning from the Food and Drug Administration, or FDA. They can increase the risk of suicidal thoughts and behaviors in children, adolescents, and young adults, regardless of age. You should talk with your doctor about severe risks with tricyclic antidepressants and other medications before starting treatment. What's the best medication for OCD? It's hard to say what's the best medication for OCD because what's best for one person may not be best for another. Each person responds to medication differently. However, SSRIs like paroxetine and fluvoxetine are often recommended first because they are considered to be safe and effective with a low risk for serious side effects. Clomipramine, on the other hand, can cause a lot of different side effects, which can include dry mouth, constipation. The side effects can vary from person to person. Be sure to discuss any side effects that you experience with your provider. Common side effects of OCD medication include anxiety, changes in sleep, dry mouth, GI upset, shaking, fatigue, light sensitivity, and changes to appetite, weight, and sexual changes. Seek professional help if medication causes you to experience any of the following: rash, swelling, excessive bleeding or bruising, uncontrollable shaking, an increased heart rate, muscle stiffness, urinary problems, breathing problems, fever, extreme fatigue, hallucinations, or seizures. SSRIs typically take 8 to 12 weeks to help manage OCD symptoms. This is longer than it usually takes for SSRIs to improve symptoms of depression, so give it time to work. Should I stop taking medication once I feel better? Often, people feel inspired to stop their medication once their symptoms get better, but medications usually need to be used consistently to maintain the benefit. In some situations, stopping a medication abruptly can cause OCD symptoms to get worse, or it can create new unwanted symptoms. These questions may be helpful to ask your doctor or prescriber before beginning taking OCD medication. How much and how often should I take this medication? What do I do if I miss a dose? Should I avoid certain foods or substances like alcohol or caffeine? Is it dangerous to mix this medication with any other medications? What should I do about side effects? Final thought, if you're struggling with OCD, you're not alone. Speaking with a therapist and finding the right medication that works for you can help put you on the path to recovery. We've linked some resources below to help you find a psychiatrist, therapist, and other helpful tools.